My involvement in creating the GM Care record has been around the information governance elements, particularly undertaking a data protection impact assessment to look at what privacy risks there might be in relation to utilising personal and confidential data as part of a shared care record. I've worked on that with a number of information governance leads across Greater Manchester, and we work together putting in place actions to address any risks that we'd identify, and we're continuing to do that going forward. In order to ensure that we keep patient information safe and secure within the GM Care record, we've introduced a number of elements. One of them is a reason to view screen that prompts the clinician when treating the patient to let the patient know that the GM Care record exists, where the information has generally come from, and that they can look at that information in order to provide their care and treatment. Another element is that the clinician treating them would have a legitimate relationship with that patient. There are also measures that the supplier has to comply with from a security perspective to make sure that we've got the correct legal requirements in place around information security. There's a number of ways that patient information can be used by the health and care system. It can be used for population health management, management of healthcare services, auditing patient pathways. We have started working with Manchester University, utilising de-identified data in relation to COVID-19 research that might help introduce new treatments or new ways of working. If someone didn't want their information to be shared as part of the GM Care record, they've got that ability to be able to speak to their clinician. And it's important that that clinician is able to explain to the individual, the security elements of the record, or the fact that somebody has to have a legitimate relationship with that patient in order to see their information. And that might allay those fears, but where it doesn't, they can ask for their information to stop being shared. And they do that by, they can go to their GP practice and they can speak to a health professional, but that can stop the data feeding into the GM Care record.